we're tackling an important topic that affects all of us, women's reproductive health. Whether you're a parent, a partner, or someone who cares about the well-being of the women in your life, understanding this subject is crucial. Our special guest will help us break down the latest options, clear up common misconceptions, and explain why access to reproductive health services matters for everyone. Let's welcome Dr. Alexandra Rodriguez, also known as Dr. Ali Rod. Hello, Dr. Ali Rod.
Hi, thank you so much for having me.
Yes, happy to have you on. So just from the get-go, I wanted to ask you, what are the biggest concerns you are seeing when it comes to women's reproductive health these days?
Yeah, this is a great question. I think nowadays women are starting to feel very anxious and worried about their reproductive health options, which is why I think it's so important that women have access to contraception, but also access to education around contraception so that they can make their own informed decisions.
And can you tell us about the latest contraceptive options out there? What makes them effective and suitable for different needs?
Yeah, so there are a lot of different options for birth control available. So let's kind of start back with the basics, right? Things like condoms. Condoms are going to be available at your pharmacy, at grocery stores, and they work great and also have the added benefit of helping prevent against sexually transmitted infections, which is so great. Next, I would say is emergency contraception. Now, Cadence OTC just launched their morning after pill, which is FDA approved and uses the #1 doctor recommended ingredient, levonorgestrel 1.5 milligrams. Now, the morning after pill does not affect future fertility, and it works by preventing pregnancy. It is time sensitive, so you want to make sure and take it within the first 72 hours after unprotected sex, but the sooner you take it, the better. Which is great because Cadence OCT is working hard to make the morning after pill accessible to you at local convenience stores like Circle K or 7-Eleven. Now, other options for birth control are things that you can get from your local healthcare provider. So things like the birth control pill or an IUD or an implant or the Depo-Provera injection. But the big difference here is that you'll need a prescription from a medical provider to get these options.
And how are convenience stores improving access to contraception, especially in areas without drugstores, and why is this approach significant?
Yeah, so Cadence OTC is working so hard at making the morning after pill accessible and affordable. So as I mentioned, you can find the morning after pill at your local convenience stores. So places like 7-Eleven, Circle K, and especially in areas where you have these healthcare deserts where people don't have access to contraception. You can now get the morning after pill at a local convenience store, which is great. And an added benefit of all of this is that it's very affordable at just under $25.
And Dr. Ali Rod, could you shed some light on how the morning after pill differs from the other pill used in later stages, especially regarding their purposes and uses?
Yeah, this is a great question and one that I get from patients and family, friends all of the time. So the morning after pill, as I mentioned earlier, works to prevent pregnancy. So it prevents the egg from meeting the sperm, so pregnancy cannot form. Now, when we start talking about other medications like an abortion medication, that works very differently because that medication works to end an already existing pregnancy. So a pretty big difference to understand between the two.
Well, thank you for clearing that up, Dr. Ali Rod. And to our viewers, you can find out more by going to getmorningafterpill.com.